regarding psychology, there are some set of structure of theories that any psychologist use it as a paradigm while defining a particular concept, or when it comes to treating or diagnosing certain mental illnesses. These perspectives play a major role in a psychologist part. So let's move on to the six major paradigms which we call theories or perspectives in detail. The first one is biological. The second one is psychodynamic. The third one is cognitive. The fourth one is behavioral. The fifth one is sociocultural. And last but not the least, we have the humanistic perspective. So let's talk about this variety of perspective and what they do talk about in the field of psychology. The first one is biological. Biological perspective states that any kind of mental illnesses that an individual perceives is either because of genes or neurotransmitter. So when we talk about genes, this comes under family studies. Genes run down within generation to generation, and it often comes down to the first degree relative. So it's like if your parents have depression, then you and your sibling have around 68% of chance of inheriting that depression, and this is going to affect your rest of the life. And when it comes to genes, we not only talk about family, but we also talk about twins. We have generally two kind of twins we talk about in psychology. We have monozygotic twins and dizygotic twins. The difference between these twins are monozygotic twins are almost identical, we cannot differentiate them, whereas dizygotic twins are totally different. Yes, they are twins, but they they look different. Only few features are identical, but monozygotic, they are completely similar. So in terms of genes, after that I have already explained family studies, monozygotic twins have almost like 100% of chance of inheriting. Both the twins will inherit the same kind of illness if their parents have, whereas the case is completely different in dizygotic twins. Dizygotic twins have around 10% of chance of inheriting. So this is what biological perspective talks about in terms of genes. The second one is neurotransmitter. Science claims that we have so many biochemicals that I almost forget, but 3 to 4 kind of biochemicals that we psychologists use are dopamine, serotonin, norepinephrine, and cortisol. So this for I have already explained you that there are several kind of neurochemicals running in our synapses, running in our nerves. But basically, when it comes to psychology and in terms of psychological perspective, we have 4 major neurotransmitters: dopamine, serotonin, norepinephrine, and cortisol, which have so much influence in our daily life. For example, dopamine is often known as happy chemical. We call it happy chemical. Serotonin and cortisol, we both call it as stress hormone, whereas norepinephrine regulates our nervous system. So let me give you people a superficial explanation. After drinking coffee or tea, suddenly we feel exhilarated, or we feel so much happy and excited to complete our work. So that's the part where dopamine plays a major role, because it's the happy neurotransmitter. So whenever you're excited while watching a movie or while drinking coffee, and especially it is seen in addicted people after drinking alcohol or after injecting drugs. Often dopamine plays a major role. The increased dopamine makes them grandeur towards their daily activities. And the other part, serotonin and cortisol, these are often this often plays a major role when a person is depressed, when a person is upset. The major cause of depression is that when when the level of serotonin and cortisol is higher in our synapses, then this is what it creates depression. And the third one is norepinephrine. Lack of norepinephrine often leads people to be lethargic and often reduces in the movement of hands and legs. So if you have a lower chemical norepinephrine in your synapses, it means that you'd not like to go to play football, you'd not like to go to party, you'd not like to go to hang out with friends, you'd just like to sleep. And this is very similar to serotonin and cortisol. If you have a high level of serotonin and cortisol in your synapses, you will be very lethargic, you will be unable to keep up with your appearance. It would be very difficult for you to go out and integrate with any communal activities. So these are what these are what neurotransmitter play a vital role in functioning in our daily life functioning.